How to tell if your cat has an eye infection. If you're a cat owner, you want to make sure that your furry friend is always in good health. One of the most common conditions cats can develop is an eye infection. In this video, we'll look at the signs and symptoms of an eye infection in cats so that you can identify it early and provide the necessary treatment. Recognize the symptoms. Once you have identified the potential symptoms of an eye infection, it is important to make sure that your cat is not suffering from any other problems. If your cat is rubbing their face or eyes, squinting, or having difficulty keeping their eyelids open, then this could be an indication of an eye infection. Additionally, if you notice any redness in the white of their eye, excessive tearing or watery eyes, abnormal discharge, cloudy, yellow, or greenish, swollen conjunctival membranes, or a third eyelid covering part of the eye, then these could all be signs of an eye infection. It is important to pay attention to your cat's behavior as well. If they seem more lethargic than normal or are having difficulty seeing, then this could be a sign that something is wrong with their eyes. Understand the different types of eye infections. Eye infections can be divided into two main categories: bacterial and viral. Bacterial infections are caused by bacterial organisms that live in the environment, while viral infections are caused by viruses. The most common type of eye infection in cats is conjunctivitis, which is an inflammation of the conjunctiva, the thin membrane that lines the inside of the eyelid and the white of the eye. Conjunctivitis can be caused by a variety of different factors, including allergies, irritants, or an underlying medical condition. It can also be caused by a bacterial or viral infection. If your cat has an eye infection, it is important to identify the underlying cause so that your veterinarian can make an appropriate diagnosis and treatment plan. Check for any discharge from the eye. It is important to pay close attention to any discharge coming from your cat's eyes. If you notice that your cat is producing an abnormal amount of tears or has excessive mucus, it may be suffering from an eye infection. Discharge from the eye can be watery or thick, and may also contain pus or other debris. If the discharge is cloudy, yellow, or greenish in color, this is a sign that your cat could be suffering from a more serious eye infection that requires immediate medical attention. Look for redness, swelling, and crustiness. If you notice any redness, swelling, or crustiness around your cat's eyes, this could be a sign of an eye infection. Conjunctivitis, also known as pink eye, is a common type of eye infection that is caused by inflammation of the conjunctiva, which is the tissue lining the inner surface of the eyelids and the white of the eye. Symptoms of conjunctivitis include redness and swelling in the whites of the eyes, difficulty keeping the eyelids open, and excessive tearing or watering from one or both eyes. In some cases, there may also be a yellow or greenish discharge from the affected eye. If you notice any of these signs in your cat's eyes, it's important to seek veterinary attention right away. Additionally, if you suspect your cat may have an eye infection, it's important to keep its eyes clean and free of discharge to help prevent further damage and discomfort. Observe your cat's behavior. When you're trying to determine if your cat has an eye infection, it's important to observe its behavior. Such as rubbing or squinting at their eyes, this could be indicative of an eye infection. These can also be signs of an eye infection. It's important to get them to the veterinarian right away for a proper diagnosis and treatment. Check for cloudiness in the eye. Checking for cloudiness in the eye is another important aspect of recognizing an eye infection in your cat. Cloudiness can be a sign of a more serious infection, such as corneal ulcers, which can be very painful and require immediate medical attention. If you notice any cloudiness or a milky film on the surface of the eye, it is important to seek veterinary care right away. Your veterinarian may need to perform an ocular exam and take a sample of the eye to determine the cause of the infection and prescribe appropriate treatment. Examine your cat's eyes in different lighting. Examining your cat's eyes in different lighting is a great way to further diagnose an eye infection. In natural light, you can often spot a difference in the color of the affected eye, or any swelling and redness more easily. Additionally, turn off the lights and use a flashlight to check for any cloudiness that may not be visible in regular light. If you suspect your cat has an eye infection, it's best to take them to the veterinarian as soon as possible for an accurate diagnosis and treatment. Look for difficulty keeping the eyelids open. If you notice that your cat is having difficulty keeping their eyelids open or that it seems to be blinking excessively, this is a sign that it may have an eye infection. This could indicate inflammation and irritation within the eye, which can be a symptom of a variety of different infections. If your cat is squinting or blinking more than usual, it is important to take them to the veterinarian as soon as possible to get them checked out. Be aware of changes in vision. Be aware of any changes in your cat's vision. If you notice that your cat is having difficulty navigating around the house or bumping into walls, it could be a sign of an eye infection. In some cases, an eye infection can cause a loss of vision in one or both eyes. If you suspect that your cat is having difficulty seeing, it is important to take them to the vet as soon as possible to get a proper diagnosis and treatment plan. Visit the veterinarian immediately. It is important to visit your veterinarian immediately if you think your cat has an eye infection. Your vet can diagnose the infection and provide your cat with the proper treatment. Treatment may include antibiotics, anti-inflammatory medications, and/or eye drops or ointments. In some cases, surgery may be required to repair any underlying damage. The sooner you seek medical attention for your cat, the sooner it can begin to feel better and get back to its usual self. If left untreated, the infection can worsen and possibly lead to long-term damage or vision loss. It is important to remember that if your cat is exhibiting any of the signs of an eye infection, it should be seen by a veterinarian as soon as possible. It is also a good idea to keep a close eye on your pet at home and to monitor any changes you may observe in their behavior or eyesight.